So, friends, I am Dr. Baishyak Renuji, Neurology SS faculty for Marrow, and you all will be in dilemma about the new NEET SS pattern. That is, it's just been nicely explained by Dr. Rakesh Nair sir and Dr. Nishant Sagar sir about how to approach the things and all. And you all, like as Rakesh sir rightly pointed, you all are very matured persons. You don't need to be spoon-fed, and you know how to plan for yourself. So I am right here to explain you how to approach neurology for the exam pattern, which may be helpful. And second thing I want to tell is that, and the most important thing I want to tell is that if you have gone through the pattern which they had put forward, they told that it is the exit level pattern, or the pattern, the syllabus you are studying in your basic subject. So it doesn't mention that it is Harrison alone, but Harrison per se neurology, as Rakesh sir rightly pointed out, it covers pretty well for neurology. But there were a few questions which comes above Harrison also. Because above Harrison or above the level what you were studying, because there are like many reference book has been suggested for your syllabus in MT medicine, which includes many books, which includes like specialty subjects books of cardiology, neurology, and all subjects are considered as reference book. And second thing is, if you see the UG level NEET exam, they ask pretty well from the Harrison. So for a SS level, obviously they had to ask some questions from a higher level than they used to ask for UG level. So certain topics which are favorite for the examiners, certain topics which you see that repeatedly coming, like slightly high-fi questions will come, that also I will try to suggest from neurology. Like for example, West syndrome and periodic complexes and CJD and all those things are not completely discussed in Harrison, but you see many question papers will contain questions coming from West syndrome, including hips arrhythmia, EEG may be kept, and absence EEG may be kept. So you cannot completely tell that it is 100% Harrison. Nobody knows from where the question paper is going to come. So we will try to make it and streamline it. At least for neurology, I'll try to, because that is my area. And when you take as a whole the importance of neurology, so in any exam pattern, you can get some questions from, one is from anatomy, one is from anatomy part, or neurophysiology or physiology part. Some questions may come. And second, you may get some questions from imaging or investigations. And third, you may get the core subject oriented questions. That is different. And some questions from the clinical medicine part. So if you take these topics like anatomy and physiology, the two subjects which is quite needed to be thorough understanding about the concepts of anatomy and physiology is, one is cardiology and second is neurology. So if they going to ask some question from anatomy or physiology, there is high likelihood that there is question may come from a neurology or a cardiology part. Then imaging, of course, they can ask, one is ECGs, then of course chest X-rays or CT. And neuroimaging is one thing which they can ask a lot of questions, and there is high likelihood to ask a lot of questions. And if they ask some questions from imaging, but there is high likelihood to be that from imaging from neurology. And clinical medicine per se, they can ask from neurology. There is a lot of science to be discussed. There is hell lot of science to be discussed, and that all comes under the syllabus of medicine only. And even cardiology is very important in that way. In that way, if you analyze, you can find out that those questions that can come outside the core Harrison, there is high likelihood that it may comes in a neurology part and cardiology part. The another thing is, neurology per se is very vast topic, and it is very important topic for medicine, as for your MD exam also. Many, like you may get a long case in medicine, so you will be well versed in neurology compared to other subjects. And neurology is, in Harrison, neurology has been pretty well covered, but there are certain areas you need to be stressed. And when you take the Harrison, you will find out that there is a lot of tables, and these tables are actually concise notes. Not the entire neurology Harrison is actually concise notes of the neurology standard books like Bradley or Adams. They are concise into notes, and some updates has been included. But The things are, one is it is difficult to study in notes without understanding the concepts. So the concepts is very important in the case of neurology. Neurology, you cannot study neurology without concepts. Neurology is one subject which need lot of basic understanding, lot of knowledge. At the same time, you need another part in neurology, that is something which by hearting. Like you need to by heart lot of genes, lot of chromosomes, lot of syndromes. So it has a nicely well pattern of concept plus by hearting. So these two is required for approaching a neurology. And for when you consider a general paper which comes in 150 questions, there is high likelihood that these areas of anatomy, physiology and imaging may come from neurology or cardiology. So if you take the Marrow SS, I had taken exclusively lot of classes about the concepts. I was trying to, each module I was trying to try to put the concepts into you. Because if you understand the concepts, if you understand and love neurology, it is very interesting. Otherwise, neurology is very boring. If you don't understand the concepts, you cannot, I personally say, you may be able to by heart few names or few syndromes name, or you may be able to by heart few genes or chromosome numbers, but you will not understand and you will not remember things that easily if you don't understand the concepts. So I will go through each module which I have covered, and I will tell the important things that you need to revise or you need to study. And second, I will tell you what I was trying to put through each module, each sessions, like what I want to convey to you. So let us start with that. So neurology per se has, one is anatomy and clinical neurology part. Second is a core neurology topic, that is what you will learn from Harrison or any books or any material, whatever it is there, any app you are following, you will get some core neurology topics. Then there is drugs. Drugs is very important because there are a lot of new drugs has been come in last 1 or 2 years in neurology, and some of which are readily coming in daily news also, like Zolgensma, which has been used for SMA, has been there in the market in India and has been coming recurrently in newspapers and televisions. So this drugs is one area that can ask potentially some questions will come from newer drugs which are not there in the Harrison or any textbooks, because there are updates. And there will be some core neurology updates like stroke updates, and all those things are not there in the present Harrison. The stroke treatment pattern also has been changed. So I have tried to put all those updates which is available at the time of I was preparing for the classes that have been included in the sessions which I had covered. And I have tried to, rather than telling you directly the points in the guidelines, I have tried to put you the concept behind why that guideline, why that new change has come up. So that will make you remember better. So that was about the drugs and core neurology topic. And imaging and investigations per se in neurology is very important. The neuroimaging is something which is like very high potential to get asked in the question papers. There are many signs are there, n number of signs are there. So we will try to see what all things we have covered and what all things you should look in each modules. So first module is sleep. Sleep, actually, in fact, I had taken a very lengthy session on sleep because first I had taken a sleep neurobiology 1 and 2, which is basically anatomy and neurophysiology. Because this if you understand this concept of sleep neurobiology, that forms one of the basic cornerstone of neurology, basic neurophysiology. Because there is lot of neurohormones, lot of neurotransmitters and lot of centers, the RAS, the ARAS, the thalamus, hypothalamus. So lot of things you can understand from that, and you will get a gross idea of the conceptual idea of the neurology. That is why I had spent a lot of time in that. Second thing is, this is one of the most difficult topic in neurology to understand. The neurophysiology of sleep is something which is very, very difficult to understand. So you can skip that, because that I have taken predominantly for the specific pattern which was previously there, like you have a specialty paper or for the institute exams. You should at least go through the sleep cycle, where that is a potential, and repeatedly ask questions. What are the cycles of sleep? What is a K complex? What is spindles? All those things along with the figures they can put. So all those things has been covered in sleep cycle. It is a small module also. So you should cover sleep cycle. You should watch sleep cycle about 28 minutes, 30 minutes. The module is there. And sleep disorders 1 and 2, the drugs in the sleep disorders are particularly important for entrance. There are many new drugs like suvorexant, pitolisant, all those things are discussed there, but I will try to include those in MCQ discussion which is coming. So you can skip those 2 modules and you can look into sleep cycle if you are planning for NEET SS. But those who are planning for the institute exams, they should go through the sleep, because this will give a gross understanding, a lot of understanding about the neurophysiology which is happening in the brain. That will give you to understand the concepts of neurology better. Then you will get a clear idea, and it will be easy to understand the things for you, especially those who are going for institute exams. Otherwise, sleep cycle 28 minutes video is something which I recommend you to watch from the sleep module. The next module is peripheral neuropathy, in which approach 1 is basically some basic idea. The last favor, small favor, all those things are included in approach 1. Approach 2, neuropathy 2, which include the last part. I have covered the NCS in this, and I will try to include the NCS part in the MCQs. Then the upper limb nerves and lower limb nerves, they are predominantly anatomy part, and of which I will tell you to read upper limb, must watch is upper limb nerves, because there is a lot of signs like OK sign, format sign, all those signs are there in this upper limb nerves. Plus the nerves, the muscles it supplies, the weakness, ulnar palsy, the radial palsy at elbow, all these are very, 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 very important. So you should read this upper limb nerves. Lower limb nerves is not that important as upper limb nerves, but for anatomy part, it gives a better idea about the plexus and all. You can read it, but upper limb nerves is a must to go through. And GBS and CADP, less like Rakesh sir has nicely pointed out. These are 2 topics which are hot topics in neurology, and there are a lot of the new updates has come in the management part and the classification, all those things which are not there in the Harrison, which I try to include in the GBS session. And even the CADP, the types of CADP, all those things are important. I have tried to include those also in the session. You can watch it in the Marrow video. So these are the 4 topics I will recommend out of this. Upper limb nerves, from the basic science point of view, upper limb nerves is a must watch. There is a lot of science and the muscles supplied by each nerve, how the radial nerve palsy, ulnar nerve palsy, and the brachial plexus, all those things has been discussed there. So that is a topic I will like to cover from peripheral neuropathy. Then hereditary neuropathy and other neuropathies. Hereditary neuropathies, I tried to make the hereditary neuropathy symbol, but MCQs will do for hereditary neuropathy. There is no need to, if you don't have time, there is no need to go through it right now. But for institute exam, again, you need to watch for hereditary neuropathies. So all the modules, initial 1 or 2 modules, I will try to put the concepts of that. I have tried to put the concepts of that individual module in that. If you watch the individual module, then you will understand the entire module better. I mean, individual first 2 sessions of the approach, you will understand the remaining things better. But you don't have much time for that right now. So you you watch upper limb nerves, you watch lower limb nerves, you should watch GBS and CADP. Then other neuropathies, I have included diabetic neuropathies, then MGUS, all those things comes in other neuropathies. That is, you can cover it with the medicine also. That is for institute exams and specialties what may be important, but you should cover these 4 topics from this part, peripheral neuropathy. Then coming to the muscle, approach to muscle 1 and 2. Approach to muscle 1 was a basic about the proteins in the muscle and some physiology things about the muscle contraction and all also discussed there. Approach to muscle 2 is predominantly a patterned approach I had discussed. That same, almost similar thing was discussed by Rakesh sir also. So you can follow that. Then coming to the remaining part, the DMDs, Duchenne and Becker's muscle dystrophy, that is very, very important topics for entrance. Especially there are new drugs, atalurin, eteplirsen, casimersen, godersen, all those new drugs has been come up for treatment of DMD, and these oligonucleotides are there. So you should watch that session, because there is the genetics, the respiratory manifestations, difference between Becker's and DMD, all those things are important. So this is a must watch for any entrance exam per se, whether it is speciality or non-speciality paper. It is very important. Then other muscle dystrophies includes FSHTs, and the genomics of FSHT and all those things are also important. So you should watch these 2 topics. Then dystrophic myotonia and non-dystrophic myotonia, it is predominantly a channelopathy, and so there is the examiners tend to ask from channelopathies and genetics of muscle is like these all things are there in the Harrison also, but it is given the tables. So if you read the tables, it is like point, you won't understand the concepts. So it is better to go through this, then you can take the Harrison table and then go through that. Then congenital muscle dystrophies and myopathies are predominantly a pediatric topics, again for institute exams, and for pediatricians it is important. Inflammatory myopathy and metabolic myopathy, if for institute exams it is important, but for this pattern, if you don't have time, so it can be covered better in your medicine discussion also, it is covered better. So you can go and watch that. So these are the topics I would like you all to watch from muscle disease. DMD per se is the most important one. Other muscle dystrophy, dystrophic myotonia and non-dystrophic myotonia are these topics I like you all to go through. Then coming to neuro-ophthalmology. Neuro-ophthalmology is something which lies between neurology and ophthalmology, but there is one important area in neuro-ophthalmology, that is the fundus. Fundus examination and the fundus pictures, they can be potential very high likelihood to come as an imaging in any imaging based exams. So optic neuritis, you should must watch optic neuritis, must watch is INO, because I have covered the INO along with some other part like the posterior INO, all those things has been covered in that small session of 26 minutes, and you will understand how the eye movement works also if you watch that video. Then papilledema per se, the optic neuritis and papilledema session, I have tried to put maximum images like fundus images. So this will be beneficial to understand the fundus properly. And the remaining part like diplopia, supranuclear control, all those things that is not that needed if the specialty papers are not there. But I will try to include some of the images from the ischemic optic neuropathy and all those things in the when I put the MCQs. So these are the three topics I would like you to watch from neuro-ophthalmology section: optic neuritis, papilledema, and INO, that is about 26 minute video of INO. This you should watch. Then coming to dementia. Dementia is one session which gives lot of idea about how the neurophysiology of brain is acting, and if you understand it, then you will understand dementia better. You can able to answer dementia better. But right now you don't have time to go through all. So I will recommend the first and most important is AD, Alzheimer's disease, the pathophysiology, the pathology, the basic genetics, everything about AD, almost everything I have tried to put in that session. What is important, almost every important things. I cannot tell everything about AD. Nobody knows like that. Even I don't know about that much everything about AD. I cannot tell like that. But you can go through AD and you will find lot of images, lot of important things in AD. So AD, Alzheimer's disease is very important topic for entrance also. You should go through that. Then cognitive circuit, I have taken two videos. Cognitive circuit 1 is about memory. In that I have discussed about Pappas limbic circuit and the medial temporal lobe structures, the hippocampal structures. So those are important. If you watch that video, right now you don't have much time. So go through what forms a Pappas limbic circuit, what forms the medial temporal lobe structures, and the classification of memory. That will be more than enough. And the cognitive circuit 2 is more of apraxias and all those things. It has been covered in the medicine also, but apraxia is important. Others are not that important when you take a non-speciality exam. A basic paper exam is there. So these two topics I would like you to go through from the dementia section. And hypokinetic movement disorders, basal ganglia circuitry, about 40-45 minutes video is there. That is a must watch, because the circuits of basal ganglia, I tried to simplify it, and the neurotransmitters, the circuits, how it operates, all those things you should have better understanding. If you watch basal ganglia session, it takes only 40 minutes. And the most importantly, atypical PD. Atypical PD, I will say that Harrison has not covered it very properly. It has just gone through the atypical PD. So atypical Parkinsonism, you should watch it, because there are two aspects here. One, there is lot of clinical science. So if somebody wants to ask from clinical medicine perspective, there is a lot of named clinical science. Second thing is the imaging findings of atypical Parkinsonism. They are very important. And third part is the proteinopathies, or the proteins involved in atypical Parkinsonism. Which are the tauopathies, which are synucleinopathies, those areas also covered in atypical Parkinsonism. So you should watch. It's a must watch is atypical Parkinsonism, and the basal ganglia circuitry also you should watch to get anatomical and neurophysiological questions. It will be covered from basal ganglia circuits. So these two I want you to watch from hypokinetic movement disorder. Hyperkinetic movement disorder, actually, there is a lot of things in hyperkinetic movement disorders, like lot of syndromes comes in that, the chorea, the Huntington disease, Huntington-like diseases, then benign hereditary choreas, dystonia, the DVT mutations. But it is a lengthy session, so I will try to include these important things, especially the drugs and the genetics and the syndromes are important. I will try to put in MCQ sessions coming. I will try to put all those things in these MCQ sessions. So you don't have to go through that at right now. I will try to include and concise it and include in the MCQ discussion part. Then coming to stroke, this is one topic, just like Rakesh sir told, I will recommend you to go through, because stroke, the guidelines has changed. It has changed from Harrison. There are some changes in Harrison, and you need to have a gross idea of stroke. Like vascular anatomy 1, 2 and 3 has not yet uploaded, that will be uploaded soon. And brainstem syndrome 1 and 2, these are basic clinical as well as neuroanatomy part. This is a must watch, because there is lot of questions will come, potential for getting lot of questions from brainstem syndrome per se. And I have tried my level best to make it simplified to you. So you can go through that. Then stroke mechanism, pathology, then stroke classification system. The acute stroke management is, I have tried to put the latest updates and latest guidelines. Then endovascular therapy, again image based many questions, as well as you will get a better idea when you watch the image based. I have tried to put it more case based approach also, so that may help you to understand it. Then stroke secondary prevention, when to give dual antiplatelets, when to give single antiplatelets, how long to give dual, when to start anticoagulation, and what to start. All those things are discussed in the stroke secondary prevention. So stroke, even though it is 12 hours, the initial 4 or 5 sessions are on anatomy. Remaining sessions, especially the management part of the stroke, is very important. This anatomy and management is a must read. This also, it is better to go through this, because I try to put many things concise into stroke. Many questions can come. It is not just I am telling about stroke. I am trying to discuss about more things, including the anatomy in this session. So you will get a gross idea, like you will be able to answer many questions that comes outside stroke also if you are going through these sessions. This is like, I will suggest you to try to go through it. Then coming to the epilepsy per se, the Harrison part is enough if you are not planning for institute exam, because institute they will ask a lot of questions from epilepsy part, especially EEG part. And EEG, only few questions being asked in the NEET pattern, that I will put in the MCQs. So what I want to watch is AEDs, anti-epileptic drug. I had taken 2 sessions, one on about the mechanism of action, and second on the adverse reactions. So these 2 are very, very important, because among the drugs in the entire medicine topic, anti-epileptic drug and MS drug, these are the 2 drugs which are repeatedly being asked for many exams. So you have to go through these 2 topics. Yeah, anti-epileptic drug 1 and anti-epileptic 2. Remaining will be covered from medicine, as well as I will cover in MCQs also. Then coming to demyelinating disease, it is like, if you are not writing an institute exam, it may not be that much useful. But the drugs in MS, I have taken in 2 sessions. The second one, MS management, you can watch if you are interested and if you have time, because that session I have tried to put a clinical approach, I had put a scenario and I had tried to make it simplified. In this case, each step what you will do and what next drug to be added. So it is better for understanding, but this is a must read, disease modifying therapy, because the newer drugs which has come up recently in 2021 August also. So those drugs are very high chance of asking in the exams. So all those things and adverse reaction, all those things are included in this MS DMT session. So it will be very much helpful to watch it, because if you simply sit and study, I feel it is very difficult to remember all the side effects, for me at least. And remaining, you can just like what Rakesh sir has told, you can follow like that. And about the cerebellum, approach to ataxia, will give an idea about ataxia. And I will recommend you to watch these 2 topics, particularly autosomal dominant ataxia, the SCARS, DRPLA, all those things are very potential questions. Autosomal recessive ataxia includes a lot of things, at least Frederick's and basic things you should go. And I will try to include all those things in exam or in the MCQ also, and as well as exams which are coming up. So autosomal dominant ataxia and approach to ataxia, 2 topics which is hot topics in the cerebellum. Anatomy, I had discussed about cerebellar anatomy, and that is a huge session. If you have time, you can watch. But these are the must watch sessions on this cerebellum. And motor neuron disease, you can watch remaining from medicine, but the SMA, there is new drugs are there. this you will see, you have been seen in the news, you have been seen in the newspapers about Solgenesma, the newer drug in SMA, onaseminogen, nabiprog, soxy, then reslipam. No, there are new drugs that mechanism of action, even the genomics and the classification of SMA, like SMA 1, 2, 3, and which is known as distal SMA, which is what is distal SMA, what is the genetic base of SMA. All those things are very, very, very important. So go through that, please go through that. I have tried my best to make it simple. You should go through that. Is at least you should study the SMA portion very well. Then neuromuscular junction, you can go through medicine. The only thing I will recommend is to go to the investigations, because the antibodies, which antibody to be done, how much percentage is positive, and what are the, how to do adrophonium test, what is tensilon test, then about many things about myasthenia investigations. Remaining in treatment and other things we will cover in the MCQ sessions. So you should go through that. This is again around 60 minutes. Then this is 2 more sessions which will be uploaded soon in Marrow SS app. This is approach to neurology and approach to human lesion. The approach to neurology, I am trying to tell you the localization of neurology, but not just localization. I am trying to tell how the neurophysiology is happening. That will help you a lot for anything, for your entrance exam or your practice or anything. I hope so. And because that is the basic concepts of approach to neurological lesion, I am trying to tell in that. Then approach to human lesion, which I am trying to cover the language part. The language, aphasia syndromes, as well as apraxias of speech, all those things are important. And I have tried to cover all those things in a minimum time as much as possible in the approach to human lesion. So these two actually covers predominantly neurophysiology thing and anatomy thing. So this is what I want to tell you. So anatomy, clinical neurology, core neurology topics, drugs and imaging and investigation. These are the things which I have tried to cover in the sessions. And among the modules, these are the important modules. This all together will come around somewhere around 30 to 35 minutes, 30 to 35 hours. So you have around 60 days, So if you watch 1 hour per day, you can cover like this in around 30-35 days. So I will recommend you, and I will suggest you to watch these videos, or at least, even though if you are not getting time to watch these videos, at least go through these topics, because these topics are important for exams. And nobody knows what they are going to ask. Nobody knows. For any exam pattern, it is like that. We have to agree to that. But these are the hot topics. So per day 1 hour you should spend. You can go through like it will take 30-35 hours in 30-35 days. You can finish it. So that was about the modules I want to discuss. So coming to anatomy and clinical part, we have covered. I have tried to put the approach to neurology, that 1 and 2 sessions, which covers the basic anatomy and neurophysiology and certain clinical things. The neurobiology of sleep 1 and 2, which is helpful if you have time, but right now it is not useful for the NEET. This pattern, it may not help you much because you have to spend a lot of time for that. So I won't tell you to follow that. But upper limb and lower limb nerves, per se upper limb nerves, there is a lot of signs are there. There are potential questions. Then optic nerve and 3, 4, 6 again I have covered in it, and the other cranial nerves has been covered very well by Dr. Rakesh sir. And lobes and circuits, per se in lobes and circuits, some of the signs, some of the areas are important, but try to go through at least to the memory circuit. And basal ganglia circuitry we have discussed, that has been covered. Vascular anatomy of brain and brainstem syndromes, that is very important, that you should study brainstem syndromes. At least go through my videos or anywhere, you should study brainstem syndromes. Then cerebellar anatomy and spinal cord anatomy are also important, but these things like approach to neurology session, upper limb, lower limb anatomy, basal ganglia circuit, vascular anatomy and brainstem syndromes, these are the basic things from anatomy and clinical, which is the maximum yield that you can get. Then coming to the drugs, the newer drugs, that is the potential area. I will try to include this newer drugs in the MCQ discussion also. So don't worry if you are not able to go through the entire SMA session, and because it is some 70 minutes session, and if you are not able to go through that 70-75 minute session, you can go through the MCQs. I will try to put the newer drugs from SMA and Duchenne muscular dystrophy and Alzheimer's disease, at latest drug approved in 2021. When even MS, there are some new drugs has come up. then migraine, the newer drugs which are not, all the drugs are not discussed in Harrison. Then the sleep, the newer drugs are there. So this part I will cover in MCQ. Definitely I will cover in MCQ. Along with that, MS drugs is there, has been there in the DMD session. And anti-epileptic drugs, I already told, I had covered it as much as possible in the 2 sessions. Then you should, even though you are not able to go through that, you should study anti-epileptic drugs side effects. There is one good table in Harrison. If you don't have time to go through my video also, you should at least go through the Harrison table on anti-epileptic drugs. Then MS, the newer drugs, again that is very, very important about the side effect profile. You should go through that, either my video or anywhere, you should study that. And stroke treatment per se, the newer guidelines, again you have to go through that. And I'm not telling you to watch that, you should watch Marrow videos or you should watch my videos. You should study these topics. These are very important topics, and I have taken effort to put forward maximum possible things that I could do in my videos. So if you are watching it, I believe that it will definitely help you. Then about NMO, MOG, CADP, GBS, myasthenia treatment, I will try to include these things in the MCQs. And Parkinson's disease and hypokinetic movement disorder treatment is very important, especially the drugs used in dystonia, drugs used in essential tremor, and I'll definitely put all those things in my MCQ. So these are the possible things which are important in the drugs. So these are the possible things which are important in the anatomy and clinical. Why I am mentioning these topics, the anatomy, clinical, because these things are not there in the Harrison which you are following. You might be following. Not all things are there because Harrison is a concise textbook. So you should watch over all those things. Then coming to the imaging, the stroke imaging, through the stroke session, if you go through the stroke, I have tried to put almost possible imaging in that. And even the perfusion scan I had put in that. Perfusion is specifically for your institutes and specialty paper, it is very important. Then IC bleed and CVT, which I will cover in MCQ. And atypical Parkinsonism and some of the imaging, neuroimaging, we are going to do a live session on neuroimaging soon. Some of the important neuroimaging, not everything, you cannot cover everything. Some important things which is quite commonly asked in NEET patterns previously, NEET UG as well as PG, there will be some overlap. There definitely will be some overlap because important things in UG for neurology is also important in PG or for DM. So that questions I will try to, not UG, for what I meant is for a post MBBS exam. That questions, mineral deposition like eye of tiger sign and other signs, that also I will try to put in some of the live session as well as to the MCQs. So majority I will try to put an MCQ session, inclusion of all those things I will try to put. And infections, demyelination, which I have covered in the imaging of MS, and I will put few things in the MCQ which is possible questions. And NCS and EEG, only the important things, as there is no specialty paper. EEG they won't ask right and left, there is less probability that they will ask everything in EEG. I mean the important things, only very few things that possibly going to them, that is my expectation. And NCS, of course, the basic things I will try to put forward when I am discussing the MCQ. And you can go through actually in the MCQ peripheral nerve session, I had put an MCQ on peripheral nerve. You should go through that session at least, because then that I had given a concise idea of all the things like the NCS, EMG, everything has been covered there. So that MCQs in peripheral nerve, that it may be beneficial to you. So that was about the basic things. So we have tried to focus, like even though it is neurology or non-neurology, some anatomy and clinical medicine part will be there. Not only neurology, clinical medicine questions can come, anatomy, neurophysiology and clinical medicine, or physiology and clinical medicine. Then core subject topics, I won't tell it is neurology because it is not specific paper. Core subject topics will be there. Then drugs, definitely they will ask, and imaging and investigations, of which anatomy and neurophysiology, neurology and cardiology are very important. Especially when you study for medicine, you are supposed to be have better idea about these things. So they will ask all those things from these areas. And core subject topics, every subject is important right now. And drugs per se, there are a lot of new drugs has been coming up because the era of gene therapy has come up. Especially in neurology, many degenerative diseases, newer drugs are coming up. So those areas are very, 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 very hot topics right now. And imaging, it is neurological imaging is very important. That is why we are coming forward to you with some neuroimaging sessions. as live sessions, and other part in the MCQs also we will try to put some images and investigations in that. That will definitely help you. So this is what I want to tell you about the modules in neurology and all. So that was about what all things you should, at least the basic things you should go through, that I want to convey was something which is outside Harrison or outside the Harrison which everyone is following, most of the people are following. Is those things is very, very important, and you should cover it. And you can go through any, like whatever you are following, whatever plans you have, whatever applications you are following, you can follow through that, but go through these topics. And now coming to the exam, you all are right now, many of you will be panicked. But I will tell you, just like Rakesh sir told, there is no need to get panicked that much, because you have a wonderful degree in your hand, that is MD medicine. So it is not like when you are finishing MBBS, taking an MD is a must, just like Rakesh sir told. For taking a super speciality, you need to have a lot of passion, because once you take it, that is your life. You cannot come back. Just like I will tell, medicine is your mother, and your super speciality, whether it is neurology or anything, it is your wife. Once you are committed, it's very difficult to do a divorce. You have to sustain in that. So you should take a subject if you like it, and you should love it, because this will be your life from that point you choose a subject. If once, like I had taken initially in cardiology, then because I was in a dilemma whether to take a neuro or cardio, I went and taken cardiology. And after taking cardiology work for 1 month, then I realized that my actual love is neurology, not cardiology. I cannot sustain in cardiology. So I was so much frustrated in that time. So I can directly tell you that how much frustration it will be there when you are land up in a subject and you don't like it. I was so much frustrated. Then I, last round, there was a counseling, and then my last option, I chose neurology, and then I joined neurology in Trivandrum. So I will tell you that you have to think and choose your subjects. That is the first thing. So right now your brain will be burning like that. You don't know what to think of. You don't know what to think of. So I will tell you to think of this. Like brain is thinking about its own image. So this is known as metacognition. So I am being a neurologist, I have to tell it that metacognition is something which helps you to learn. That is something which has been well developed in humans, that has helped us to learn a lot, discover a lot, and that has made us invent a lot of new discoveries. So that is evolution advantage that humans got. So the first thing for metacognition is a basic step of learning, is a goal setting and identification of the difficulty of task. So your goal set is your exam that is coming up in November, and you should first identify the difficulty of task and what all things you should study. Rather than studying everything, you should do a smart study. You cannot study everything right now. You should take those high-yielding topics and go through it. So that is the identifying the difficulty of task, and nobody knows the exact pattern that is going to come up. I cannot tell that this questions or this pattern will be there. Nobody can tell that. For any exam, it is in fact like that. Somebody can come and tell that that pattern will come for exam for sure, but I am not telling that. I cannot tell you that this is going to the pattern, because that only the person who is putting the question will know in any exam. So what you know is what all things you have to study, and what are the important or hot topics usually that to come. That is quite frequently coming. So that is the goal step and identification. Next is the most important, is identify your strength and what is your weakness. To understand your weakness is the most important part. That is why you need to plan for yourself. You cannot follow anyone. If I tell this is a strategy, you cannot follow it, because your difficulties and your strength will be different. For example, me, per se, I am very dyslexic. It is very evident in the videos which I have taken. I have dyslexia. I have struggled with that when I was doing my entrance coaching, but I developed my own technique to overcome that. So you also should find out what is your weakness, what is your strength, and you should develop your own pattern. Even though it is 2 months, you can plan and make a structured timetable and go through that. And that is for planning. So first is a goal setting and identification of difficulty of the exam. Second is to identify your strength and weakness and plan according to yourself. Don't follow anybody's plan. Follow your own plan. Everyone, you all are very much matured and you know what is your strength and what is your difficulty and which area you are weak and what type of adaptation you need to make. So that is what is the most important, and each step you should monitor. So monitoring, I have a small suggestion which I did. So what I did was I used to take a book, and when I get up in the morning 5 o'clock, I will write 5 o'clock I started reading. Then till 7 o'clock I will be reading. 7 o'clock I will write 5 to 7. Then 7 o'clock I may go for breakfast and I come back 7:30. Suppose I start reading again 7:30. Suppose 7:45 I got a phone. I was in a call for about 15 minutes. So I'll remove that 15 minutes from my study period. At the end of day, if you calculate how much hours you're studying, you will realize that you may hardly studying 3 or 4 hours. So daily, if you write it, like, it is possible for a short duration only. You cannot do it for 1 year. So if you daily write down it, you can slowly improve the number of hours you are studying. It may be possible, may not be possible to everyone. It was my plan. I thought it may help you, but it is again, you have to decide it. So you have to, the only thing is you have to monitor whether you are going in the right path, whether you are going to your plan, you are sticking to your plan. That is monitoring. And adapting as and when necessary. Right now the pattern has changed, so you have to adapt for that. And evaluation is where the Marrow or any other app is going to help you right now. Like you can get the subject or get the topics from anywhere. The important topics you analyze, you find out, and you can get from anywhere. There is a lot of sources, lot of applications are available, lot of books are there for entrance preparation. So you can go through anywhere. But evaluation is the most important step. That also you can go through by repeated exams and find out where you stand. And then you try to improve. That is evaluation. So that is the most important step right now, is to understand the depth or the step or the difficulty of the exam, understand your strength, plan appropriately, adapt appropriately, monitor yourself whether you're sticking to your plan, and last step is evaluation. So plan, monitor, evaluate, and most important is revision. You should keep time for revision, that you can plan according to your pattern, but my recommendation is at least for last few days, you should keep for revision of your own notes and write out, especially in neurology, there is a lot of syndromes and gene, write those in separate books and revise it before the exam, otherwise you will forget. Nobody can remember. So the most important is the day before exam or before the exam, there is a lot of stress. Stress has two parts. One is excessive stress, which can make you forget everything and you won't remember things. But you need a stress. You need some amount of stress, some amount of good stress, some amount of stress that will motivate you to study. And there should be a limit between that. Like, you should never fall into severe stress and don't get too much panic for exam, because you now have a very good degree of MD medicine, very beautiful degree of MD medicine. In fact, I love MD medicine very much. Like, it's a very beautiful degree. So you don't need to worry, don't need to get tensed up for exam. Just go and deliver your maximum. You should have the right amount of stress which will drive you to the exam. And most importantly, keep sanitation, mask, and don't get infected with COVID-19, because that may make you fall sick and sometimes you will not be able to attend the exam. So the most important I will tell you is to maintain social distancing, mask and sanitation. You all know very well, but be careful, don't get infected right now. That's all I want to tell you. So all the best for the exams. Try to we will be coming up, as Rakesh sir and Nishan sir has told. We'll be coming up with MCQ sessions, question papers, and all those discussions will be coming up. So you all have to study well and try your maximum. All the best.